I'm Dr. Bojana Jankovic, and I'm here today with my colleague and dear friend, Dr. Katie Velesny, who is a dermatologist. And we're going to talk to you about how to potentially detect skin cancer and what are some of the risk factors, as well as what is really the evidence behind screening for skin cancer. So one of the things that I often get asked is that distinction between squamous cell carcinoma versus basal cell carcinoma versus melanoma when it comes to skin cancers. And oftentimes it seems to me that there's a lack of emphasis or education in terms of what are the types of cancers that we really should be most concerned about and most proactive about screening for, such as melanoma when it comes to risk for metastatic potential, versus the other ones that, again, of course, need to be screened and looked at, but that are a little bit less likely to be more invasive and so on.
Yeah, and so you highlighted the three that we commonly see, which is the basal cell skin cancer, basal cell carcinoma. That one is the lowest risk, and so it tends to not metastasize. It's very, very, very rare for that to spread in terms of any distant spread. Squamous cell carcinoma is the next sort of high risk up on the ladder, and that one has a lower but a small potential for metastasis, and so we do monitor that one carefully as well. And then melanoma, of course, being the most high risk, and it can be quite severe and can be deadly in cases because it can metastasize. And so that is one in which we're very mindful of when we're screening for, to make sure that we catch it early if we can.
And that is the one where there's a genetic linkage as well, right?
Yes.
So if you have a family member, that's definitely something that your doctor should know about.
Exactly, yeah. And so when I ask about family history, that's mostly what I'm curious about. We know that what we call non-melanoma skin cancers, the basal cells and the squamous cells, they are common as people get older, and as our population is aging. I see it every day, and very frequently in my patients. And so that family history is less important, although interesting, because there's it's mindful of the sort of environment you grew up in and the type of skin that you may have, but family history of melanoma is definitely important to know.
And then in terms of, that kind of brings us to our next question, which is, should we be screening for skin cancers? How we should be screening? Is it something that we should be doing on self-examination versus should our doctor examine it periodically? And what's interesting is that the U.S. Preventive Services Task Force found that there's currently insufficient evidence that self-examination or physician examination for skin cancer leads to reduced morbidity or mortality from melanoma. But I'm also aware that there's some evidence suggesting that actually may be helpful to screen. So maybe you can kind of break it down for us.
Yeah, and so, it's a great question, and we don't have great evidence either way. I can't say you need to be screened annually and you shouldn't. We do know that when self-screening, so a patient looking at their own skin, or a physician screening, the earlier you catch something, the better, particularly when it comes to a melanoma. And so that is often why we do make these recommendations around annual screening, even though we don't have the best evidence around it. Typically, if a patient comes in and they have multiple nevi, nevi being the other word for moles, maybe over 100, or if they have atypical moles, or if they have a family history of melanoma, they've had lots of sunburns, maybe they've used tanning beds a lot, and we know tanning beds can contribute to these skin cancers as well. That sort of patient, I may say, I need to see you once a year to do a skin screen, or your family doctor or primary care physician, someone needs to be looking at your skin yearly. And so we make that recommendation based on those risk factors.
And then some of the things that patients or people can do at home in terms of identifying those concerning features of nevi that could point to potentially melanoma. Oftentimes we use ABCDE. That's kind of the gold standard of how I would talk to patients when it comes to what are the concerning features you should be aware of.
Yeah, and the ABCDE rule is great. And so, it does prove challenging sometimes because people can have odd looking things on their skin and they don't know. But when it comes to a mole or a dark looking spot on your body, you can use this rule. And so how that plays out is A stands for asymmetry. So if the actual lesion's quite asymmetrical, it's not round, it's got some unusual features in terms of symmetry.
Yes, and then B is for border. So anything that has an irregular border that's not kind of nice and round can be concerning.
Yeah. C is for color, and this is a helpful one. You know, a mole that's quite uniform in terms of its color, just brown, or even, you know, a darker color is okay, but one that has, maybe okay, I shouldn't say always okay, but can be okay. One that's got lots of different colors, maybe red, brown, black, white, those things mixed in can be a concerning feature.
Yes. And then D is for diameter. So how big is this mole? So anything greater than 6 millimeters, when it gets to 6 millimeters or more, that's when we start to get concerned. So this is about the size of a pencil eraser.
Yeah. And then the last one, E, you know, I think is a very important one. E stands for evolving. And so is it changing? And that's often what will get me a little concerned if they say, you know, I've had this mole for a long time, but now it started to grow, or it started to itch, or started to change. That's something that I think is really important. And I will say one more feature that's not in the ABCDE rule, but also the ugly duckling sign I often comment on it. So it's like one of these moles just looks different than the other. There's something like, you know, many people have moles that kind of fall into a pattern and they look similar, and all of a sudden there'll be one that just looks different. That's another feature that you can look at as being mindful that we may need to screen that one or potentially biopsy or remove it.
Yeah, so, you know, we've talked about some of the features that are really important to look at. We've talked about some of the benefits of screening, both by self-examinations as well as by your physician. And we've also talked about some risk factors and types of skin and sun exposure that could certainly lead to a higher risk of skin cancer. If you have any concerns at all, you should contact your physician and have a skin exam. Thank you so much for watching.